hey, we need this, or we're out of this, or can you order this?
And in the meantime, you're trying to place your order and there's people like, hey, 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 hey.
That's most of my job is people yelling, Chris.
It's like a circus every day.
Sorry, one minute. Hello?
Actually, I am the practice manager, so I run the clinic. I do payroll. I actually do vet assistant work, and I work in surgery. I do it all, and then I do inventory along with all of my other duties.
Answering phones, dealing with HR stuff, all that kind of stuff.
You're never just doing one job. You're always doing your regular job plus about 3 other things.
I'm responsible for, upwards of $2 million a year while trying to keep everything running and going. It's a lot of weight on your shoulders.
It's tens of thousands of dollars. It's actually kind of ridiculous how much money that we spend in the clinic in a week.
With our current inventory right now, I'm responsible for 20% of our revenue.
20 to 22% of my hospital revenue.
I was just handed it and said, here's what we need. We want to keep, X amount on the shelf, and we don't ever want to run out.
I was just told you're the inventory manager now. Like, there's no handbook. You don't know what you're doing. You just do the best you can.
It's like, it only take 5 minutes. You just walk around the hospital and shake the bottle. If it seems low, you order some.
Absolutely, the inventory manager is blamed.
So we had to just dispense stinky cheese medication for months, and everyone was horrified. And everybody gave me dirty looks every time they dispensed it. And they said, this smells horrible. And I know, I'm sorry.
We could have a full week of all the prevention that anyone could ever want. And then that one time that we're out of the antibiotic that we use every 6 months, that's when you hear about it for sure.
I'll have people come up to me, why the hell don't we have injectable Serenia? And I go, I don't know, dude, we haven't used it for 3 months. Why would I order extra?
But unless you're hitting that point, nobody even mentions it. There's never, thanks for making sure we got everything. It's kind of a thankless job in that aspect.
Often people aren't telling you that things are well stocked. They're telling you when something is out.
Once a quarter at least, you're here after the building closes and you're staying until you're done. It could be 6 hours, it could be 8 hours, depending on how well it goes.
I sacrifice lunch pretty much every day. I eat, but it's just eating at my desk while I'm doing XYZ task.
I don't think people realize that I can't just order one item at a time. I need to order at least a couple $100 worth of items.
Most of the time, or after hours, it would usually just be me till 9 o'clock, just entering counts.
I frequently wake up in the middle of the night worried that I forgot something and that I didn't order something.
Actually, I just recently had a dream about my sharps container, which is kind of an inventory thing. You have to have enough sharps containers on hand to do your sharps, and all of my sharps containers were overflowing with needles. And I was trying to find somewhere to put them.
My biggest nightmare as inventory manager is finding a discrepancy, especially in a controlled medication.
That still happens. So yeah, you have those night terrors of, oh no, do we have enough of this drug? We have 6 surgeries tomorrow. Do I have enough product?
It's always when it's needed. Hey, we're absolutely out of this right now for this patient that's here at this very moment.
Hey Cody, we only have 3 bags of fluids left. What do you mean we only have 3 bags of fluids left?
If I had $1 every time I heard that, I could probably retire by now.
And it's always when you are in the middle of something that somebody will run into your office and be like, I'll be elbows deep in financial reports, and somebody will just stand in my door and be like, hey, can you order this for me real quick? And I'm like, what? I'm sorry.
You love animals and you want to help them.
As a little 5-year-old, I knew that's what I wanted to do. So it's something I couldn't imagine myself doing anything different ever in my life.
I got into it because I'm good at it, and this is not a job that everyone can do, so I do it for people that cannot.
Loved animals, grew up with animals.
to me, it's kind of the glue between the clients and the patients and getting their care, because the doctors, yeah, they do the physical take care of them, and they do diagnostics. But if the inventory manager is not on hand to have all the products that you need, the doctor's diagnosis isn't going to help.
So it is kind of an irony in our profession that inventory managers are said to manage this big beast within the practice, and here's a PIMS, figure it out. Without any real training.
Unless you've done it, I think it is a job that is very underappreciated in the hospital and has such a vital role to your hospital's overall health, because at the end of the day, it's keeping your clients happy to have what they need in a cost-effective way, right at their fingertips.